What is the one thing that your patients want more than anything else? And the answer is predictability. If they don't know what's coming, they get a little nervous, and that can turn into fear, and that's the enemy of a great patient experience. My guest today specializes in removing fear at the dental office, but her ideas, I promise you, are universal. I'm Carl White, principal at Market Advisory Group, which is a healthcare marketing agency, and I'm also the host of PracticeCare. The mission for both is the same, and that's to help private practice owners stay private. Not only is that what they usually want, but care is better when the provider owns the place and has the most freedom to make the clinical decisions they think are best for their patients. Unlike other setups where somebody else owns the place, like a hospital, a health system, a DSO, private equity, you name it, eventually the agenda of the owner starts to whisper in the ear of the provider, and sometimes that can cause a compromise, whether small or large, for patient care. And in my opinion, let's just keep that all out of the way. Today, my guest is Jessica Martin. Jessica is the owner of Martin Management Consulting and co-owner of Martin Dental, a successful dental spa in Eau Claire, Wisconsin. Jessica is a licensed school psychologist and helps medical professionals understand why patients feel anxious or fear at the dentist and other medical appointments. She's created strategies for dental offices to remove some of the most common barriers to dental care. She loves sharing ways to make the experience positive for every patient. Jessica has also been involved in leadership positions for 2 local networking organizations for the past 8 years, and she's assisted well over 90 business professionals thrive and be more successful. Jessica, thanks for coming on PracticeCare.
Thank you for having me.
Yeah, I've been looking forward to this one for a while. In a prior part of my career, we worked a lot. We called it customer satisfaction, but the concept was the same. And one of the things that boiled to the top pretty quickly was this idea of predictability. And people just want to know what's coming. They don't always like it, but if they know it's coming, man, that calms down a lot. And we're going to get into that. But I want to start with your background, where I start with just about every guest. We got some of your background in your bio, but fill in the gaps. And what I'm curious about is why you made the moves you made, how you ended up where you are now.
Yeah, it's an interesting story. None of it was planned. When you talk
Right.
about predictability, and I am a type A person, so the journey I've been on in the last few years has been very exciting and interesting because none of it was what I had ever imagined.
Mm-hmm.
I went right out of undergrad into my master's program to become a school psychologist. I worked in the school settings for 10 years. I loved the work. My husband was in dental school when we met, so that's the tie to dentistry. I had
Okay.
really no interest in dentistry prior to knowing him, but when we purchased our practice in 2010, I got involved into some of the back end, helping him running the business a little bit and some of the marketing. And we needed to grow our practice. And I really kind of quickly discovered in that process of trying to promote and grow it that there was a lot of psychology in dentistry because so many people are anxious. And so that led me to developing the concepts that we use now and that I teach now with the consulting, but none of it was anything we could have predicted. I honestly am still sometimes surprised at how well it works. It's some of those things I think that happen organically are the
Yeah.
best. And even with the consulting, never planned to do that, but I just had enough people say, I think you have something here and you need to share it. And I think it could help a lot of people. And so that's what I'm doing now. And I love it. So it's very fun.
And I'm curious, how does your time split down approximately on, working in the dental practice versus the consulting and everything else?
Yeah, I'm not super involved in the dental practice on the day to day any longer. It just became too much. And honestly, we have an amazing team. They don't need me to be there all the time.
Right.
So I like to still be around. I like to see what's going on because I do think it helps me with working with clients to know still how to run the practice and be involved in it.
Yeah.
But I don't need to be there on the day to day. So
Got it.
I'm mostly doing the consulting, but I do still show up there a few times a week and see what's going on and help out occasionally when needed.
Sure. So fear of the dentist is not new. It's quite well established for good or bad. And whenever you say dentist, I think most people flash to in the chair, what's coming, look at all those sharp things. But I'm wondering, what are some other areas of a dental patient experience that can generate fear, anxiety, unpredictability? What would you say?
I mean, I think there are just so many details that we, as providers, we don't think about that can really, trigger the patient or cause feelings that
Mhm.
aren't pleasant. And I think it can be anything from silly things that sound really trivial to, like the parking experience when they get there, and what it feels like to walk in, and what does it look like, and how organized do things seem, and are things neat, and or are they cluttered? How am I treated as a patient from the team? What are those phone calls like?
Yeah.
How does that money exchange go, right? There's so many pieces of it that really, like you mentioned earlier, kind of can relate to any business
Hmm.
that can alter the experience. But I think dentistry is unique because patients feel really vulnerable in the dental chair. And it was funny because I have a client that was one of the hygienists that, after we had done some training on patient experience, had said, I don't like the idea of having my patient's eyes covered, because one of the amenities I'll teach is to use an eye mask if the patient wants that. And she's like, I like to be able to see my patient's eyes. And I said, well, that's great. And for most patients, that probably works. But for the patients that want the eye mask, imagine like getting a massage and having to keep your eyes open, because it's awkward to just close your eyes in a dental chair. Unlike
Hmm.
a massage, you just close your eyes, right? Because
Yeah.
you're really vulnerable. You're not clothed. You're covered in a blanket.
Yeah.
But in a dental chair, it's a similar feeling. So imagine having to keep your eyes open because that's like what's socially kind of expected, but you're that vulnerable. Like it's
Hmm.
really awkward. So I think there are a lot of nuances because of the vulnerability that dentistry presents that are largely overlooked to how the person feels receiving treatment all the way through the process of walking into the business and out.
Yeah. So is the vulnerability, is that why fear or unpredictability is such a barrier?
I think so. I mean, not only are they feeling vulnerable because someone's in an orifice of their body, but also they have no way to really know what's going to happen, or what things will be or feel like. And if they have had a bad experience, or they have sensitive teeth, or whatnot, they're maybe expecting it to be unpleasant, even when
Mhm.
might not be. So if providers can do, and we'll probably get into strategies, but the more that we can prepare them for what to expect.
Mhm.
Oh, this next part you might feel a little pressure, or you might have a funny taste from this next thing I'm going to do. It doesn't have to be super detailed, but just to give them those cues so they know, okay, this is normal, what that sensation is that I'm feeling. I think
Right.
that's super important. And then little things like, cueing the patient on the phone, like how long the appointment's going to take, so that they don't schedule something else that they have to rush out for, because that causes everybody stress. So there's lots of little ways that I think we can make it a calmer, more enjoyable experience.
Yeah.
We don't really think of.
Yeah. It's, as you were talking, I was thinking about myself or anybody else. We want our health to be good. We're coming to you, Dr. X, provider X, because we think something's off. Um, you're the one who knows what's going to happen, and we do not. And in
Right.
life, there's always time for adventure. Adventures are great, but ironically enough, people tend to choose their adventures. They don't always know what's going to happen, but then we're going to take an adventure vacation, but we know it's coming because we just booked it. The idea of knowing what's coming is where your opening eyes, I think, is that it's in every little detail. And yeah, it's,
Right.
this is going to taste a little funny. It's going to hurt a little bit. Going to have to keep your mouth open. Just, yeah, what's coming?
And I
Simple.
think with dentistry, we're actually working against predictability in a sense, because people expect it to be painful sometimes, or they've heard things like, oh, I've heard root canals are awful, or,
Hmm.
getting a dental implant sounds so scary because of what they've maybe heard from the media or from other people. And so not only are we needing to tell them what to expect, but we have to work against what they're already predicting might
Yeah.
happen because of what they've heard.
Yeah.
So it's interesting. Yeah.
Yeah, I know you've heard this is a 9 out of 10 on the paint. There's only be 5 here, right?
Right, right.
But it's funny. So we do a lot of online marketing work, and every practice already has or should have a free listing on Google called a Google Business Profile. And when I have a new client, we do just like I'm like, look, do a photo tour of the place. If they're close by, I'll do it. If not, and if you look at, you can tell, Google will tell you for all the pictures that you've got, all this stuff about your profile, you can see who's going, how many clicks, how many this, and the pictures, the interactivity with pictures dwarfs anything else. People want to see where they're going,
Right.
and the more you give them, they're like, oh, okay. And then when they walk in and they see the waiting room looks like the picture, like, okay, I'm
Right.
calm. I'm
It's all
calm.
making sense in their
It's all
brain.
making sense. And whether people cared about that 25 years ago, if we say, let's just either way, let's assume 20, if nobody cared and today they do. Okay, well, today they do. Um,
Mhm.
and you can judge it all you want, or you can just accept it. And here's the other thing. If your competitor's got plenty of pictures and they're making people feel calmer. Just they know what's coming and you do not, like it or not, as whatever you think or you're judging this topic right now, you're behind a bit. And so just do these things, think about these things.
And if you can brand and market to be known for caring about comfort and caring about the experience, again,
Yeah.
now we can allow them to predict that it's going to be better, right? Their mindset's different going into it because that's the energy you've created around your practice. So
Yeah. Yeah. And dental, dental to me, more than many other parts of the world of healthcare, just seems to have a bit more of a like a retail component. I don't know how else to say it. And, compare yourselves to a retail store. People walk in, they know where stuff is, they know what it costs. Not that there's insurance. But the predictability is there. It's
right.
just there. It's either there on the shelf or it's not. It's available in your size or not, whatever it is. And so there's a little bit of, whether the industry's done it to itself or not, it's there. And so the more you can think about these things and kind of implement them, the better off. So there is a revenue component to this, I would think. Patients that feel better come back more, adhere to their treatment plan, tell friends and family. How have you found, how does fear and unpredictability impact the revenue? How could it impact the revenue of a practice?
Well, I think it impacts everything. Whether patients keep their appointments, whether they're willing to accept the treatment the doctor proposes, whether they'll stay with the practice and have patient retention despite changes. Maybe, your office decides you need to increase fees or you need to drop an insurance network. Those changes have to, you have to offset those changes with some value to the patient. And that predictability, that ability to comfort and relax and provide a better experience can really offset a lot of those other things. People move away. People, it's less convenient. They move the other side of town, and you need to still be able to kind of draw and attract that. And if you can capture the patient experience, you're well on your way to having more retention and having more attraction to the practice as well. When you're into marketing, so it's all like, how do we, bring people in without so much effort, without having to discount things or be in every single network and take half of what we really deserve for the treatment we're providing. This is a way to attract those right people that value quality and good dentistry and care.
Yeah. And I think dental, more than most other professions, understands the value of keeping patients over the long haul. It's hard to get, if you think about, for every $100 of treatment revenue, you can get it from a new patient or from a current patient. It's a lot more profitable and easier if you get it from current patients. But you need your current patients to say things like, yeah, it was a good experience, in any way they say it. If somebody says, hey, I'm looking for a dentist, how was Dr. So-and-so? Yeah, no, it really hurt the other day. And they're not going to know why. Now, it was going to hurt whatever it was going to hurt. Right. They say, boy, it really hurt. If they didn't know it was coming, maybe they'd say it anyway. But if they were told in advance, like, this is going to hurt, let me tell you what you're getting into, they may not say that. So yeah, it's good. Totally same experience, different assessment of it when asked. And big difference. I think dental gets it more than a lot of others. It's just the difference between keeping your current patients happy versus getting new patients. Of course, you want to do both, but your current patient population can be the engine, one of the engines of getting new patients on top of the other stuff. It's hard when there's a lot of patient churn. It's hard when they don't stay, right. when there was no other reason then. You're right, there are reasons patients leave a practice. One of them is they weren't happy with the treatment they were getting. At least you can knock that off the table. And what you're talking about is one way to do it.
Yeah, I mean, some of the numbers that we've seen at our practice have been pretty astounding. We started this approach back in 2014. It took about 2 years to really develop, and I had to do a lot of trial and error because no one was really doing what we're doing. And we saw crown production increase by 50%. And I asked my husband, are you proposing more crowns? Like, what's happening? And he's an ethical provider. He does not propose things that are not there. And he said, no, I think it's just case acceptance. Like, people are just relaxed, and like the trust is so solid that they're just like, yeah, let's do it. So we saw crown production increase, as well as overall production triple over the course of years. Like, it's been astounding. And then new patient numbers have quadrupled. We would average like 5 new patients a month initially to having to cap 25 new patients a month, because he had so much existing work then to treat with patients. He's like, I can only see so many new patients and do a good job for those patients that have been with us for a long time. So, I mean, these are good problems to have to cap new patients and whatnot,
Yeah.
but it wasn't with discounts. It wasn't with flashy marketing. It was just by, really doing better for people and then letting that speak for itself to an extent.
Which is a huge part of marketing that not a lot of people realize. The flashy part is promotion. Promotion discounts, that's promotion, but a patient experience, it's massive. And during that, when you started doing this in 2014, along the way, were you doing other things that you could you say because of these efforts, that's why more or less crown production increased, overall patient volume increased? Or were you doing other things along the way also, where you could say, well, we think it's some of that, but it could have been this other stuff too?
Yeah, that's a good question. I think the only other thing I can really give a lot of credit to throughout that process is networking. I've done a lot of community, like on the ground networking with other business owners, and that I think super powered what we were doing, because it allowed us to share the ways that we were different and how we were differentiating with more people, and build that trust quicker with those people that we're networking with. So I think that is super powerful, and most dental offices don't do that at all or enough, and
It's so true. So
Mhm.
maybe, the networking took the crown production from, I don't know, 25% to 50%, but it was probably going to happen anyway. That sounds like a reasonable conclusion
Right.
because of what you were doing. And if you weren't doing these other things, maybe you would have had an increase, but maybe the churn would have been the same, whatever, you know what I mean?
I think if I had just been networking as a regular dental office, I know we wouldn't have seen the numbers up like that. Like because even when you're, meeting people and building relationships, there still needs to be a compelling reason for people to change. Back to predictability, right? You'll hear people say, oh, I hate my dentist, but I just go. It's like, it's where I've always gone. I just continue to go. There are those people that will just continue to do the same thing because it is predictable. It's what they've always done. It sometimes takes a moment, a really negative experience, or something that seems markedly different to cause them to go, all right, yeah, I'm gonna try something else.
Yeah. So what are a few examples of strategies you've implemented in Martin Dental other than, let's say, the in the chair experience? Because I'm looking for some unusual areas to really try to open people's eyes to, wow, wouldn't have thought of that, just to get people to think more expansively.
Okay. So I think a big thing, and this again goes back to some of the patient mindset, but I think a big thing that any office can do without altering really anything else they do is to develop, I call it a comfort form. That's what I developed for our practice and for my clients. But it goes along with the new patient paperwork, and it assesses how they feel about dentistry or how they feel about coming into the office. And we ask all these questions on the medical history, and we often don't ask, like, how do you actually feel about being here or coming in? It asks about previous dental experiences, previous dental traumas, if there were any. And then it asks specific language about components of the dental experience that might cause them to get anxious. So it's things like the sound of the drill, it's seeing instruments, fear of needles, it's loud noises, bright lights. It's things that the patient themselves probably doesn't realize bother them, but when they see it in print and they're like, actually, yeah, like all that stuff gets me, or no, it's just this one thing. Well, now.
So they're like twitchy nervous when they sit down for the first time because they've read about all these things. Like I'm picturing, I wanted you to say like, and after then we consult with them. Like the first visit is
Well, you do go over it, right? I think the idea would be like, they get to put it out there, how they feel. Ideally, you'd have them do that well in advance, right? So they're not doing that in office, because that causes stress too, having to fill out 5 minutes of forms and paperwork while you're just getting to a new place. So no, that's done in advance. So they've had time to process and come down from the language they've seen of all the things that could be scary. But then I think it is important for the team to go through it and say, oh, I see you're really comfortable being here. Awesome. Or, wow, I see that, you had some bad experiences as a child. We're going to do it. We're going to do it better. And I see that the sound of the drill really bothers you. Here's an option for that. And whether the team has a bunch of tools in their toolbox to accommodate what the situation is, I think just having that small moment of understanding allows the patient to go, okay, like they get me. they ask the questions, and when you see like all the red flags of people being super anxious, the team is going to be a little bit more gentle with things, right? They're going to call it kid gloves, right? They're going to be a little more just caring and concerned and checking in if they see that on there. So I think that alone is so simple and so something anybody could do without adding anything else. I think, most offices I go in, there's always little areas that I can go, wow, okay, like what's happening here? Because, in our normal spaces, we get used to seeing what's around us, and we don't notice how that might impact others' perception. And so there's clutter, or there's just, stuff that doesn't belong. And there's always little ways. So I would always encourage people to have somebody that's not familiar with your practice do a walkthrough, and with those fresh eyes to notice the things that you're probably just, you see too often to notice. The other big thing that's super simple is dealing with the smell. So anyone that works in a dental office does not notice it anymore, because it's called desensitization. Your body's natural response to allow you to work in that environment is to get used to it so that it doesn't bother you anymore. But patients that are coming in every 3 to 6 months, they get blasted by a wall of nasty scent. And I can remember before I was involved in our practice, and now our practice smells beautiful. So it's not even then, but even way back when we were just a regular dental office and we didn't do anything to thwart scent, I can remember walking in and being like, oh, I just gross. And your patients are feeling that. So in the lobby, right in the entrance, find a way to diffuse oil, or, get something in there that's going to take care of at least the initial moments they walk in, because that's when their body's kind of adjusting to that new environment. And that can make a huge difference.
And smells like a massive trigger of
of
any kind of response, right? And it's long, like years, decades, like you smell something from whatever, forever ago, and it could just bring you back, and whether that was good or bad, you're going there. So that makes a lot of sense. That's cool. And what I like about the questionnaire in particular is that that's something that a patient could actually see and maybe tell somebody else about. It's very tangible. What'd you like about it? Well, they asked me all these questions about what I'm afraid of, and then they hit every one of them, and it just felt really good. Nobody else does that too. I mean, other than those you've consulted with, but probably nobody else does that. And so it's really, a lot of practices do things to set themselves apart from their competition, but they end up doing it in a way that nobody else notices, or that they can't take home and explain to other people when asked. And since, they're not mega large companies that have ad budgets on their own where they could just jump over their customer and tell people this is why we're so good so that it gets imprinted. You need, the vessel of your patient to go out and say it on top of you saying it, but they can't if they don't understand it or they don't notice it. And so it's really nice that you got that tangible aspect in there too. I love it. So in the interest of bite-sized advice, I say this to a lot of guests, we could go, so I have like 15 other questions I'd love to ask you, but I've got to adhere to my own rules. So there's a couple of questions that I ask every guest kind of as a wrap up. The first one is there anything you think I should have asked you, but just didn't in the context of our conversation?
Well, I thought you were going to ask, like, what is being a dental spa look like? That's like one of the typical questions. And so just to quickly summarize, the idea of, I call them amenities. It comes from my work as a school psychologist and understanding sensory perception. So what I've realized of why a lot of people are anxious, and they probably don't know why they're anxious, they just know they don't like it, is it's their sensory system putting off these red flags saying, this is not pleasant, because our sensory system is in our bodies to let us know things are good or things are bad.
Right.
And we want things to be as good as possible in an experience that we're asking people to pay for. Right. And so the amenities that I teach teams how to do, either provide that positive sensory or try to remove some of the negative sensory. So like noise reducing headphones is an example. The eye mask that I mentioned before allows the patient to not see people like hovering over them, seeing instruments coming toward them, just allows them to zone out. You can add sensory into the headphones or to visual by, tuning in music or letting them watch a program. That's adding positive sensory. You can use blankets, regular blankets, weighted blankets. That's adding sensory. You can add cool or hot items, depending on if the patient's sweating or if they're cold. There's just a lot of little things we can do that are really low cost that are going to tell the sensory system, like, it's okay to just cozy in and be here. And
Right.
we're going to take care of you and make them feel nurtured and comforted. And so just in a nutshell, that's kind of what it looks and can feel like.
Okay,
Yeah.
cool. And the other question that I ask is, so we've caught somebody's attention who's listening, and you've gotten them over the hump. They want to start tackling this. Sometimes people can get stuck on where to start. So what are one or two areas, simple things that they could do to get started on this, like now, as soon as they're done listening?
Yeah. Like I said, I would definitely, they walk through their office, walk through the front door like a patient would, and try to see things, with patient eyes, or have someone else help them kind of do that. Definitely to go through and look at what people are seeing and experiencing. I think, even just for doctors, if you have a hole in the schedule, rather than sit in your office and check email or get caught up in lab work, maybe just sit in the front for a little bit and just listen to the patient interaction, some of the phone conversations. You might go, oh wow, I didn't realize we were telling patients that, or I don't really like how that was said. Not that you want to micromanage your team by any means, but just to find areas that of the patient experience that you maybe have been unaware of because you're in a different area of the business for the most part. Simple things like colors can be really powerful. Like, this color on my wall is really soft and warm. I love having treatment rooms this color, and a lot of the rooms are white and clinical feeling. There's ways to bring in more of a homey feel to your office to warm it up and make people feel like they're not at a hospital or a doctor's office, and make it feel more comfortable, which is simple things like colors or plants. Those little tiny things can go a long way. And you could do that over the weekend. Just grab a few things and cozy it up a little bit. Yeah, those would be like the quick things that I think anybody
It's
could
true.
do.
As you said that, I thought where my dentist, the treatment rooms, they're kind of small. And most of them has like large kind of X-ray thing with the arm and the whole, it's large, it takes up space. What do you do? Like when you have a small space, just same answer is just,
Same answer. Honestly, when we built a new practice 2.5 years ago now, so we have large, beautiful treatment rooms. But before that, we were in this tiny, tiny little office, and our treatment rooms were very tight. And I still went with a darker kind of warm color. And it's sort of, people think, oh, if you go darker, it's going to feel smaller. We had so many compliments from patients saying, this feels so cozy. I love the color. It just kind of calms it down, because you can't do much about like the dental equipment, the dental chair, right? It doesn't look
or like your
comfortable.
primary care, like there's
Yeah.
the sink, there's
Yeah.
there's the
Like, you
whole thing,
can't
there's the table.
change all
Yeah.
of it. So you
Yeah.
have to kind of work with what you can. And color is a really quick and easy way to do that. And even in a small space, color can make a huge impact on mood.
Perfect. Perfect. That's easy. Go buy a few plants and just don't overthink it. I could see
Yeah.
myself overthinking it. How about this plant or that plant? Maybe if that's you, then find somebody else. But I like the idea of just walking through, find somebody with fresh eyes, who's willing to point stuff out, and just whatever they say, make a list and just attack it and see what happens. And it sounds like you kind of went incrementally. Like you didn't do everything at once. You started somewhere back in 2014. You had a better idea than most because of your background. And then it sounded like maybe you were just really observant. Where is their uncertainty now? Where is their lack of predictability now? What are they saying? Did you quiz the staff? What do you think? And then you just go,
I did.
sort of
Yeah.
attack the issues that you find, right?
Yep. It took years to really, like I said, kind of trial and error what would make sense and kind of create that special sauce. It did take a long time, and that works. It just, now that I see what it did for the bottom line, and just the freedom we have. We're completely out of network. We have a great
Wow.
demand. We don't have to market. I see what it did for us, and I see, like, that's why I love being able to bring it to my clients in this package now, to be like, hey, let's do this. Because they can get there much quicker,
Yeah.
and without the worry of the stress of, am I making the right decisions, or, we have to wait for this all to kick in.
Yeah. Right. Perfect. Well, thank you so much, Jessica Martin with Martin Management Consulting. I really appreciate you taking some time to come on and sharing these ideas with us.
Yeah, thank you for having me.
Perfect. And you gave us contact info for you. We're going to put them in the show notes for your episode. And just a couple of quick points to listeners before we wrap up. First, if you are someone like Jessica who consults with private practices with some expertise to share, or if you are a private practice owner who's figured some stuff out on the business side and you think others would benefit from hearing what you figured out, Either way, we want you to come on PracticeCare and share your insights with our listeners. In the show notes for Jessica's episode and every episode, there's a link, a couple of clicks, a couple of questions. Tell us what's on your mind so we can get you scheduled as soon as possible. And finally, if you haven't done so yet, please subscribe to PracticeCare. We have a new episode every week. We're on Apple, Spotify, Google, all the major platforms. Make sure you subscribe. You subscribe so you can keep up to date. Thanks very much. And until next time.